Since the start of the conflict in Sudan on the 15th of April, over 4.3 million people have been forced to flee. This includes over 900,000 refugees and asylum seekers who fled to neighboring countries, and 195,000 South Sudanese forced to return to South Sudan. Within Sudan, over 3.2 million people have been internally displaced, including more than 187,000 refugees already residing in the country at the start of the crisis.
The conflict in Sudan has had devastating impacts on people's lives, their health and their well-being. About 67% of hospitals in the affected areas are out of service. In these past 4 months, since the conflict began, WHO has verified 53 attacks on healthcare, which have killed 11 people, injured 38, and along with other disruptions, these attacks have denied access to care for tens of thousands of people. We've also got ongoing outbreaks of measles, malaria, dengue, and they're so difficult to control in this context of insecurity, people moving, population displacement, and non-functioning laboratories. More than 40% of the country faces hunger, and about a third of children under 5 are chronically malnourished, making them even more vulnerable to disease. As I'm sure you know, measles and malnourishment equals the death sentence for children under 5.
The High Commissioner is saying that the disastrous, senseless war in Sudan, born out of a wanton drive for power, has resulted in thousands of deaths, the destruction of family homes, schools, hospitals, and other essential services, massive displacement, as well as sexual violence in acts which may amount to war crimes. The UN Human Rights Office has also received credible reports of incidents of sexual violence, of some 32 incidents of sexual violence against 73 victims as of the 2nd of August. This includes at least 28 incidents of rape. Men in RSF uniforms were implicated in at least 19 incidents as perpetrators, and the actual number of cases is likely much higher. The High Commissioner has urged senior officials in Sudan during his visit to Sudan and repeatedly since then to issue clear instructions to all those under their command that there is zero tolerance for sexual violence. Perpetrators must be held accountable and such violence must be clearly and unequivocally condemned.
Some of the disruption in the services and how the disintegration of the social fabric is also leaving many women and adolescent girls at risk for both the lack of health care, and that includes 2.6 million women and girls of reproductive age who require humanitarian assistance. Just to paint that picture for you a bit more clearly, around 260,000 women are currently pregnant, and almost 100,000 of those will give birth in the next 3 months. Without the critical services, including the hospital and safe delivery, their lives and those of their children and the babies that are going to be the future generation are severely at risk.
The war is destroying people's lives and their homeland and violating their basic human rights. They call on the parties to the conflict to end the fighting, protect civilians, and give humanitarian organizations unfettered access to all people in need in all areas of Sudan. They remind the fighters that attacking civilians, looting humanitarian supplies, targeting aid workers and hospitals, or blocking aid, things we have seen throughout those 4 months, may amount to war crimes and crimes against humanity.
The collective commitment to provide can make the difference. Currently,
not document or investigate cases